Hi, it's Sabrina coming back with another video, kind of a follow-up video to a couple of questions I received regarding my adrenalectomy. It's been a couple of years now since my surgery. Everything is still going well. Pretty much no problems with everyday life. A couple of questions that I got were regarding, let's see here, any hair loss, any weight loss, anything like that. Now, I will say that before I was diagnosed with hyperaldosteronism, big long word, but basically, before I was diagnosed with it, I did notice some thinning in the crown of my head. I found out that I had low potassium and low iron. So, once your body's out of whack regarding minerals and vitamins, then that could result in hair loss and other characteristics in our body, visible characteristics. So, with that being said, I just began my own regimen of vitamins. I think it was skin, hair, and nail vitamins. Nothing fancy, just something from Walmart. I can't think of the name of it. I believe it's Spring Valley. So I did that. I did about 10,000 mcgs, I believe it was. I did that. Hair came back thicker, back to normal. So I can't say that. Well, I guess I could say that it was related to the condition that I had at the time. But then after surgery, everything pretty much corrected itself. So maybe I didn't even have to take the vitamins, but I will say that it works. Meaning, like, your hair grew, well, my hair grew, my nails grew, my natural nails, they grew, and I'm a nail biter. So this is like the impossible already. But that happened. My skin cleared up. I will say, if you choose to go the route to take like the skin, hair, and nail vitamins, or any type of vitamins regarding your hair with biotin in it, you have to drink plenty of water, or you will experience breakouts. So make sure you're well hydrated. And again, if you're under a doctor's care already dealing with any type of condition, just run it by him or her just to make sure that you're okay to go ahead and take that vitamin if you choose to. Another question, let's see, that I had. Mood swings. It was asking about, did you experience any mood swings when you had problems with your adrenal glands? Yes. Yes, I did. I was short patience. Just overall, just did not feel good. I was just in a cloud, in a fog, in a daze of just not feeling well, ready for the day to be over so I could go to bed, just pretty much missing out on life. And that pretty much resolved itself after surgery. So I would just say, if you're someone that has surgery pending, then that should clear up not long after surgery. For me, I will say immediately after I had that surgery, I felt better. Just overall health, mental health, stability, just positive outlook on life. I felt better. I felt like I could even see better. My vision got clearer. And I guess that could contribute to the high blood pressure, and just the pressure on your vessels, your eye vessels, and that type of thing. So I guess with all of that now being subsided, the pressure behind it, that could attribute to why I just totally felt better all across the board. And I mentioned in another video that I did lose weight. I'm still losing weight. I chose to go the ketogenic route, low carb, high fat diet. And I've done that for like 3 years, and I've lost 136 pounds. So I will say that it works. No Slim Fast, no Atkin bars, no type of supplements, anything, none of that. But it will take everything, meaning I no longer eat sugar, I no longer eat bread, any of that. Now, there are alternatives with this lifestyle. Once you become, I guess, adapted to the ketogenic way of eating, yeah, some people choose to do the bulletproof coffee where they put the butter in the coffee. You can do, instead of regular pancakes, you can do almond flour pancakes. So you do have variations within that way of living. However, it's almost like detox. Like, you're detoxing from the excess carbs and sugars. And for me, I no longer have any type of urge, any type of, I don't know, just desire for cake, desire for cookies, desire for pies. Like it just kind of it went away basically. But it will require you to be disciplined. You have to want it. In order for it to continue to work for you, you have to be consistent. So for me, I can't do any refeeding. Some people, especially bodybuilders, they can do that. You know, they're well trained. They know how their bodies are. But for me, I'm just little old me with no type of experience that studied the ketogenic way of living. And for me, it's best for me to keep my carb count under 20 grams a day. No sugars or anything. I have to watch the dairy, watch the nuts. But however, it just works. It works for me. So I can't tell you exactly what to do because what works for me may not entirely work for you. You may be one that ketogenic may not be the best way for you. It may be too strict. You may be one that just watch your sugar intake and you'll be surprised about the weight loss that you could experience by doing that alone. So I hope this answered all the questions that you may have. You can definitely feel free, as you've done before, to email me. Send me a message with any questions, anything that you have that you would like for me to cover in another video. And thank you so much for watching. Thank you for your love and support. I read the comments, and I made that video regarding my condition because when I was going through it, I came to YouTube. I didn't see anything. I went to Google. Everything was so limited and everything was more of a theory. No one could really say, oh, just because you have high blood pressure, they didn't let me know that it could be a benign tumor on your adrenal gland that needs to be removed. Like, I didn't know that. So it was like trial and error as I went. And I had amazing doctors. I just had the best experience. And it's crazy, but it's just kind of like, if it had to happen, it was the best situation. So I just wanted to reach out to others that possibly were going through the same thing, kind of didn't understand what was going on with their body, and were just looking for answers. Early morning, late nights, and you made me know, just through your comments and just well wishes that I'm on the right track by sharing my story. And as I said before in other videos, once I had my adrenal gland removed, my right adrenal gland, I'm on no medication, nothing. No medication was required after surgery. Blood pressure medication was discontinued. I was taking potassium. I had to take potassium. All of that was discontinued. Now I'm just simply on a one-a-day vitamin. That's it. And so if you're someone that has to have both adrenal glands removed, of course, you'll probably have to take some type of medication that will fill in the gap for what your adrenal gland would do for you every day. So just stick with your medication. That's it. That's all you have to do. Just stick with your medication every day, like you get up, like you brush your teeth, and go on with your life. It's just that simple. The worst part is just before you know what's wrong and you're trying to figure it out and you're kind of off and not your normal self. That's the worst and scariest part. But once you discover what's wrong, don't be afraid of surgery. Just go in, let them do what they need to do to get you better. And again, thank you so much for everyone with your warm, well wishes and just taking the time to respond to my video and ask questions. Thanks again.